Hey guys, welcome back to the channel. So today's video is going to be very important because today I am going to tell about why the crown dislodges again and again. So a lot of time I get this question from my juniors and colleagues ki my crown is coming out again and again. What cement should I use? What cement should I buy from dental cart? Which cement should I buy from this? और यहाँ पे product fake है, ये अच्छा नहीं चल रहा है. So most of the people, they are mostly focused on this type of cements which they want to use in their clinic so that the crown doesn't come out. So it's not about the cements that I want to tell you today. It's all about what type of preparation you're doing. That's very important in clinical dentistry and prosthodontics, because there are few tips and tricks which will tell you which will help you in your clinical practice, और कम से कम आपका crown dislodge होगा. So usually patients pay a lot for the crowns and they expect a huge means they will think that they can eat everything, and the patient will also think that okay, this will be there for in their mouth in the entire lifetime and it will never come out. But कभी-कभी ऐसा भी होता है कि next day patient comes and they say कि yesterday only you have put the crown and today it has come out. So basically the first thing we need to do in crown prep after a root canal treatment is give time for your crown prep. This is a very important thing which I am telling you, because most of the people are busy in doing the crown cutting rather than focusing on the root canal, the crown structure, the tooth structure, the length and breadth of the tooth, and the anatomy of the tooth itself. So you have to see how is the position of your tooth, how much crown is available actually. So minimum 4 mm of crown height is minimum required for the crown to retain. So many of the people, what do they try to give angulation कि इतना angulation होना चाहिए और तब crown जाके retain होगा. तो फिर usually I have seen in crown cuttings people give over angulations and more undercuts. So you have to try to reduce your undercuts, and the angulation should be little bit taper. It should not be like totally 30-40 degree taper. I've seen crowns like a mountain, and how can you expect a crown to be there for a long time, right? It has to be uniform. It has to be uniformly tapered and rightly beveled with bevel locks, and you have to give proper finish lines, chamfer, shoulder, whichever is required, using new burrs. What I usually see is people taking the crown, cutting the top of it, मिजल डिस्टल में गड्ढा कर दिया, बस crown prep हो गया. And most of the people, what they're doing, they're giving the lab persons to do the crown cutting, which is I feel is totally wrong. And you should do the crown as being a doctor. You should like do the crown cutting yourself, right? It's not like the patient is paying for you, right? He's not paying so that an attender comes or a lab technician comes to do the crown cutting. That is in the mind of the patient. Okay, someone else is doing my work. Okay, he's not a doctor, he's a lab technician. Okay, in times of emergency, sometimes you can take a help, but not always. I have seen people depending upon the lab technicians to do the crown cutting, and they just sit and they keep on scrolling their appointments according to the lab person's appointment. So it's very strange and bizarre to see dentistry like this. So you need to do your crown cutting yourself and give at least 30 to 40 minutes of time before taking any impression. Make sure that your impression is absolutely dry, your mouth is absolutely dry while taking the impression. Try to use putty and light body, which is a very beneficial, because the quality of materials if you use in a clinic definitely it will show up in the crown or whatever work you are doing. Sometimes people are also offering all the 3D scanners in your clinic. Call them. They are providing it for free. You can just tell the patient to wait for 1 day, and the scanner person will come, the lab technician will come, they will scan the tooth. So many advanced techniques are available. Why not to just stick with alginate and take the impression? Okay, so you have to take a proper impression. There should be no air bubbles. The pouring should be good. So nowadays the AI generated system is there, CAD CAM, with which you can easily fabricate the crown in your clinics as well. So there are a lot of modern amenities available which we need to use in nowadays. हमारे टाइम में alginate होता था और कुछ नहीं होता था. उसके बाद पुट्टी आया, alginate पुट्टी करने के बाद now it's AI generated. I know the cost is more, but now the lab persons are providing it for free of cost or at minimal cost. So you can always tell your patient, wait for a day and do the crown preps. And one more important thing we have to learn, that is crown lengthening, which is a very important procedure, because mostly in 6/7 मोस्टली वी डोंट हैव क्राउन हाइट. समटाइम्स होता है ना कि एट्रिशन टूथ हो गया है और आपके पास स्पेस ही नहीं है क्राउन लगाने का, तो हम क्या बोले पेशेंट को, हमको समझ में नहीं आता है. तो फिर in those cases we have to do crown lengthening, call a periodontist, increase the height of the crown, then give the crown. That crown will never come out. Recently I finished one case in which the crown height was totally less and the patient had a bridge in which the crown height was very less, only 2 to 3 mm. How will the crown stay in that place whenever the patient is going to chew, it is going to dislodge. So we did a proper crown lengthening for that patient, and after that the patient is happy. One patient happy will send you more 10-15 patients. So this was all about today's video. I hope you like it. If you follow my Instagram channel, its name is Sai_dental, and we have opened one academy also. The name of the academy is Sai Dental Academy. It's in Bhubaneswar, where we run a 3.5 month dental course for excellence, where you will learn all the dental work within a span of 3.5 months. You won't become an MDS, but you will be able to run your clinic and for diagnosis, treatment planning, management. It's in Bhubaneswar, so do check at www.saidentalacademy.com. Till then, take care. Love you all. Bye.